Some 700,000 people die of resistant infections every year, instances where existing antibiotics are unable to arrest an infection.
If we don't solve this problem of antimicrobial resistance, we will not deliver SDG 3 on healthy lives. We won't deliver universal health coverage. And we won't deliver health underpinning all of the SDGs.
Briefly.
The study was undertaken by economist Jim O'Neill, who famously coined the term BRIC, the forerunner to BRICS, in 2001.
We need to invest in the 29 recommendations that we have outlined, which we think would cost about $40 billion, which is a lot of money, but it is less than 0.25% of global GDP. And an investment of $40 billion, not all of which has to come from public policymakers, $40 billion to give a return of 100 trillion is an investment fund that I would like to run.
Dr. Aaron Motsoaledi, in his capacity as chair of the Stop TB Partnership, pointed to the lung disease that affects 9 million people annually, many who die of drug-resistant TB.
Apart from the fact that it contributes 1/3 of all antimicrobial death, it's very expensive. When people have got drug-resistant TB, it requires a long period to treat them. It usually takes about 2 years, sometimes even longer, in which you must use multiple drugs, not one, a multiplicity of drugs, which are very toxic, and the outcome will only be at best 50%.
The UN will host a high-level meeting in September to forge a path ahead, with a forewarning that lower income and developing countries are likely to bear the brunt of any drug-resistant explosion in the face of weak public health systems coupled with global inaction. Bryce-Pease, SABC News, New York.